very common to see problems in children's feet where the Achilles attaches onto the bone, and this condition is called Sever's disease. And in the knee of children, again anywhere from the ages of 9 through to 15, we see where the quadricep muscle attaches into the bone just below the knee. These are particular conditions associated with rapid growth, softness of the bone, and increase in activity. And they're very disabilitating and producing a lot of pain, both in the heel, associated with Sever's disease, and in the knee, associated with Osgood-Schlatter's. Quite complex names for fairly simple conditions. What occurs is that if you look in, this is the foot, these are the toes and the heel. The Achilles comes down and attaches into the back of the heel. And because the bones are growing, there's a small, what we call growth plate in the back of the heel. This bone hasn't quite set and formed, and where the Achilles attaches, so it's actually where the bone attaches onto the other bone, you get inflammation and a lot of pain. And the same is said for the knee in Osgood-Schlatter's. So really these conditions are an overuse when children are increasing their activity, and the tendon starts to pull the bone away from the bone. And it's purely due to softness of bones and too much activity. There's many different approaches to the treatment of this, but we feel the best approach to this is immobilization. And it's interesting, you'll read lots of different papers about trying to strengthen something that's irritated, stretch it, rub it, do all sorts of different things. But the most important thing is immobilization. And it's a little bit severe to put a youngster in a cast. We're not going to put them in a cast, but we can put a knee range of motion brace on them. And we leave this on for about anywhere between 4 and 6 weeks. They can still walk around and do their activity, but they can't play sport. And then we can put a boot on them. And a boot is it's a cam walker boot, which can be taken off to shower and to sleep. But again, this reduces the amount of activity they can do, and obviously it helps it heal. And particularly useful for parents, because I have 2 young children, and to try and hold them down and not get them to do activity is almost impossible from a parental perspective and even a physiotherapy perspective. So the key for us, the primary first key, is to make sure we reduce activity. And that's where the use of a knee range of motion brace, not just a soft brace, but a brace that you can get from the physiotherapist or myself, or a cam walker boot, a bit like a ski boot. And we put these on and they stay on for about 4 to 6 weeks. Number 1 priority, and that's to reduce activity. It's easy for mum and dad because when the child is at school, they are unable to run and play sport because they have a boot on. So it's much easier for us to implement that reduction in activity. This idea of trying to get a child to reduce their activity by 25%, 50%, 75% means nothing to a child. And we feel that the aggressive use of a boot for the first 4 to 6 weeks reduces the symptoms almost immediately. Once the symptoms have reduced, then we can start a strengthening program to stop this happening again in the future. This idea that there's just a reduction in length of the muscle and it's all about tightness is an untruth. In fact, a lot of the children that we see, their muscle length is normal. It is purely due to overactivity. So most important thing, see a physiotherapist in these situations, have a boot applied or a knee range of motion brace. Expect this to stay on for about 4 to 6 weeks. Then the physiotherapist can weave their magic in building the strength up and looking at load in reintroducing them back into their activity successfully, and this reduces the likelihood of reoccurrence. I review a lot of patients, so youngsters here between 9 and 15, who have seen multiple physiotherapists, multiple orthopedic surgeons and sports physicians, because they have not reduced their activity in these particular conditions. They reduce their activity by using a boot. It's a fairly hard approach to start with, but the results are much better, longer lasting, and quicker to achieve full resolution of discomfort. Thanks very much.